Good day. My name is Deja Abdol-Hagg, and this is Open Arms Healthcare Center, Mississippi's only healthcare center that has a specialty emphasis for the LGBT community. As you can see, it's a very home-like type of place, because the idea is we want everyone that comes to the clinic, no matter what community they represent, to feel welcome and at home. Though the clinic has an LGBT focus, it is open to the public. Open Arms is an arm of My Brother's Keeper, and My Brother's Keeper has been dedicated to reducing health disparities with target populations across the country, especially Mississippi, that have been overlooked and underserved for years. Initially, we started in the realm of HIV education and prevention, but now we have dedicated a lot of time and energy into cancer research and, of course, healthcare on a comprehensive level. Thus, this clinic. I'll take you on a tour. How you doing, Mr. Eddie?
You all right?
Good. How are you?
Oh,
Charlotte's here with
What's going on?
Rainbow, and she is doing a walkthrough of the clinic. Mr. Eddie here is the facilitator for our support services, specifically our food pantry. And how long you been with MBK, Miss Eddie?
MBK?
Mm-hmm.
About a year and a half.
About a year and a half. Yep.
I've
But
been doing food pantry though for over 20 years.
for over 20 years, yeah. So he is an expert at providing assistance for the community, and you can tell.
Are we going to get food for Rainbow?
I don't know. But you know what? This month we are the recipients of their Roundup Award. And initially they did initial interview, but we lost that, so we're just going another walkthrough. So, but they are gonna at some point have an opportunity to sit down with us and talk about healthier food options for the entire clinic. You know, I was really excited about that. But yeah, Mr. Eddie has a relationship with lots of people, and it becomes
Glasses on,
very important for us to make sure that we maintain rapport with the people that we serve, and Mr. Eddie is really good at that. Come on back. This is one of our counseling rooms, and this is our food pantry.
Yeah, because it needs to be light for this to do.
Okay, good.
You might explain what the initials, you know, LB.
LGBT. I can do that. Well, it depends on who you ask. You may see LGBT, GLBT, LGBTI, but in essence, LGBT is the lesbian, gay, bisexual, transgender community. And though, again, we have a specialty emphasis, and I'll tell you a little bit more why we decided to put a special emphasis on that community later once we work through the clinic. But the clinic itself, we don't turn anyone away. Insured, underinsured, not insured. You know, there's a sliding scale system that we use. The idea is to get everyone in to have care that can't find another physician to, you know, adhere to their needs, or maybe they just feel uncomfortable. You know, I felt uncomfortable going to my doctor. Not decent bedside manner. I didn't feel like you were really interested in you know, the way that I felt, or the condition that I had, or you were just dealing with the condition as opposed to figuring out the root cause of, you know, the condition. So I've been, you know, back and forth with doctors for years. I came to see Dr. Diane here. I feel completely at home. She's the first person that addressed my hypertension by talking about my stress levels. And we talked about the diets I have and the ways that I sleep. Basic stuff. Genius. I love my doctor. Anyway, this is the food pantry. I think they do food deliveries or food distribution twice a week. And people sign up and they just come in and get their foods. And of course, you know, we have our beans, proteins. Right now, I think today they were actually doing food distribution, so we may be a little low. But we also do meats. I think right now we got chicken breast left and a couple of beef patties here. But we do distribution today, so that's the reason that it's probably a little low. We are working on expanding a partnership with Extra Table, which is a food pantry service here in Mississippi, but they focus solely on providing healthier food options through food pantries. Studies have shown that most of the people that are suffering with food insecurity and obesity are persons that have low to no incomes, people that usually depend on food pantries such as these. But we don't want those persons that can't, that have hindrances or hurdles with their income to have unhealthier food choices because of their income. So we're working on creating healthier ways to get dried fruits and vegetables, low sodium foods, low carb foods, so that we can create a healthier option for the people that we serve. Of course, standard kitchen. Storage room, you leaving me?
Yeah, I need you to go to your business. Go away.
What do I?
She's taking you. Go to your business.
Go, what business I got?
You're doing with her.
Oh, okay.
Go to your business.
All right, but you don't need me?
Mm.
Why are you mad at you still didn't tell me why.
I know.
I'll email you. Okay. This is our pharmacy. She'll edit all that out. We'll do that, yeah. This is the pharmacy. We're working on a partnership right now with one of our local pharmacists to actually house her pharmacy here. That way all of our patients will have an opportunity to get all of their meds here. There's some persons that may have conditions that they don't feel comfortable getting their medications outside. So they won't have to worry about that once we are actually up and running with our complete pharmacy. So all of our medical needs can be met here. Secondary waiting room. This is our laboratory / triage, where Dot does all of the blood drawing and blood pressure taking and talking to you at length about what your statuses are. This is a really high-tech machine. You actually stand on it and it'll give you your BMI, which is your body mass index, and if you talk about what your weight goals are, it'll give you, you know, what your caloric intake needs to be per day to get to that. It's just a really sophisticated way to give you a lot of information that you need. So this is where she does all of this, and of course she has all of the equipment that she needs for glucose measurements. They do, of course, HIV testing here, syphilis testing. Most of these pieces of equipment, if I'm not mistaken, were actually donated. Yeah, they were actually donated. I'm walking past you anyway. Okay. Back here we have our other restroom, our handicap accessible restroom, interview rooms, which is very important here. A lot of times when we're doing studies that are dealing with underserved populations that don't feel comfortable dealing with doctors and major universities, they can come here to actually facilitate those studies. A lot of behavioral programs are based on the results of studies with different target populations. So we have a very good rapport with the community here in Mississippi. So we're going to be focusing a lot on conducting our own research here at the clinic, and this is one of the interview rooms that we'll be using. Dot, the superstar around here, that's her office. I was just saying your name because that's your office.
Hi.
And of course these are all of our interview rooms. All of our interview rooms. I was telling you earlier about the reason that we have a specialty emphasis with the LGBT community across the nation. Well, as of late, because of the debate with gay marriage, you have a lot of emphasis being placed or spotlight on the LGBT community. But as they're doing that, you still have these, are people that have basic needs, including health care. In Mississippi, the LGBT community has suffered a special isolation because we're in the Bible Belt and we have really specific ideas about who people are. And because of that, you have a large group of people that have not been able to receive medical care. You have transgender persons that need their hormone therapies that can't get them from regular places or regular physicians because they're mistreated when they come. Or you have someone that is gay but can't get the proper respect that they deserve or attention that they deserve when they go to the doctor because the doctor has resistance talking to you because of the lifestyle that you live. And to me, it's against the whole idea of do no harm, which is a part of the oath that every physician takes. And if you're not open comprehensively to me as a human being and dedicated to caring for me as a human being, then you're doing me harm. And we want it to be a solution to that. So at Open Arms, we have a special team of people that are specially trained and dedicated to providing care to that particular community. I hate that door. For instance, if I come in and I'm transgender, but my ID says Sam, but I refer to be called Samantha, that can be very damaging for me to be sitting in the lobby, the lobby, and hear you call, my name, and I don't want to be referred to. It's very socially damning, very spiritually damning. But we have a process that, that we adhere to. When you're filling out your application, you put your name and what you prefer to be called. I don't even use my legal name on my, it's my grandmother's name. I don't use it. So I prefer to be called Deja. And it's all about respecting the whole human being. And that's what the health clinic is about. Just respecting and taking care of the whole human being with no stigmas, no hesitation, completely open. This is one of our waiting rooms. Of course, there's lots of literature about different health disparities, particularly HIV meds, and ways that if you are positive, ways to take better care of yourself. Not just with pharmaceuticals. Nutrition and sleep. All of the things that you need to maintain the immune system that you have. And we're not just focusing on HIV positive persons, we're also talking about HIV negative persons and ways that you can maintain the negative status. Make sure I'm not leaving any lights on. Restroom. Nurses station. We have a team of doctors from all over the Southeast that have been dedicated to working with our clinic. Some volunteers. We are a nonprofit. MBK is a nonprofit organization, so this entire clinic was a project of hard labor. Most of the persons here that were working on getting it together are actually staff at MBK. So right before the clinic opened, we were here late night scrubbing and screwing and learning how to paint and learning how to wire and figuring a way to get the whole process together. So it's a labor of love for all of us. But after the labor part comes the real work of inviting people to come, because the same people that have been underserved for years, I've come to the conclusion that there's nowhere for me to go get care, and they're being ill, and we want them to come because that's what we are here for. We're here solely to serve the underserved and make sure that we're serving them with open arms.
And you haven't been open very long.
Oh no, we officially opened February 7th, which is National Black HIV/AIDS Awareness Day. And we had representatives from the CDC come down to talk to us about what a monumental thing this was to have the clinic. Not just to have the clinic, but to have it here in Mississippi. There were so many people that said that it was not possible for us to do this. But Dr. Gibson, who is the CEO of My Brother's Keeper, and Dr. Hickson, who is the COO of My Brother's Keeper, were adamant about making sure that we were doing exactly what we needed to do in order to serve the population that we serve. And there was a gap in services for health care. We were educating people, but we were noticing that they weren't going to see a physician because of the mistreatment that they were suffering. And the more we studied, we realized it wasn't just locally, it was all across the state. We have people that are excited about coming in from Memphis and from Alabama and from Arkansas, because in essence, they don't have any place to go there either. So we have a really big job to do and a lot of people to serve, but our primary objective is to let everyone know that we're here and that we're really serious about providing comprehensive care. Physical care, mental health. We have a therapist on board. We're having a hormonal therapist come in, I think in June. And the more we do, the more we'll learn about what we need to do. So we need the people to come so we can care for them and learn about the other things that we need to do or services that we need to have to make sure that they're getting comprehensively cared for.
And besides I know you have a leak in the roof because you had a tarp over there. Besides,
the hail did it to us.
yeah, besides needing money to fix the roof, what else?
Because
does
we're
Ground
a
Up
new
go
clinic, and
to?
again, we're a nonprofit. The idea is that we have to be able to pay, the physicians. We have to be able to keep the building open, everything that, we need to maintain the building. The lights have to be paid for, the water, the most of the information that we have provided, we have here based on donations. But when persons come to get pharmaceuticals, there are programs that we have to help you get those medicines at a lower rate or no rate, but there are other medicines that we can't. So we're trying to, we went out on a limb here opening the clinic, and everything that's here has to be paid for, the service providers and the service. So we're just trying to make sure that we maintain. one of the bigger things that we're doing right now is making sure that we are marketing in a healthy way, because we want to specifically reach that LGBT community first, because we want that community to feel welcome. That's the community that has not felt welcome anywhere else. We want that community to feel welcome primarily, and then to focus on, you know, making sure that the entire community comes, but primarily that particular community.
Well, thank you, Disha. That was
Thank you.
very, very informative,
Thank you
and we
very much.
appreciate that.
Thank you so much. Thank you, Rainbow.